On the evening of February 19th, 1994, what began as a routine emergency admission at Riverside General Hospital would very quickly turn into one of the most perplexing and controversial medical incidents ever documented in the United States. At the center of it all was a 31-year-old woman named Gloria Ramirez, who had been brought into the emergency department in a critically deteriorating condition as a result of advanced cervical cancer. Her situation was already dire before she even arrived, and the medical staff on duty that night understood that they were dealing with a patient whose body was failing under the weight of a long and aggressive illness. However, what no one in that room could have anticipated was that within a matter of minutes, the focus of the emergency would shift away from the patient herself and toward the sudden and alarming collapse of multiple members of the medical team attempting to treat her. When Gloria Ramirez was wheeled into the trauma room, her symptoms were consistent with severe systemic distress. She was disoriented, struggling to respond coherently to questions, and showing clear signs of respiratory compromise. Her heart rate was dangerously elevated, and her blood pressure suggested that her body was no longer able to maintain stable circulation. In situations like this, emergency protocols are followed almost automatically, with trained professionals moving quickly to stabilize the patient through oxygen administration, intravenous medications, and continuous monitoring. The atmosphere in the room, although urgent, was not unusual for a hospital emergency department dealing with a terminally ill patient. What began to disrupt that sense of routine, however, was something subtle at first, an observation made during a standard procedure that would normally attract no attention at all. As a nurse drew blood from Gloria, she noticed an unusual smell emanating from the sample. It was not the sterile clinical scent that one expects in a hospital setting, but rather something sharp and chemical in nature, often described later as resembling ammonia. While unusual odors can sometimes be present in patients suffering from certain metabolic conditions, this particular smell was strong enough to raise concern among the staff present. The anomaly did not stop there. When the blood sample was examined more closely, those handling it observed small, shimmering particles suspended within the liquid. These were not typical clots or contaminants that might occasionally appear under certain conditions. They were described as crystalline in appearance, something that the staff could not immediately explain. At this point, curiosity began to turn into unease, as multiple individuals in the room became aware that they were witnessing something outside the boundaries of normal medical experience. Shortly after this observation, the situation escalated in a way that was both rapid and deeply unsettling. One of the nurses began to feel lightheaded and had to sit down. Another reported a burning sensation on her skin, particularly on her face and hands. Within moments, additional staff members began to experience symptoms that ranged from nausea and dizziness to difficulty breathing. What made this development particularly alarming was the speed at which it spread among those present, suggesting that whatever was causing the symptoms was not isolated to a single individual, but was affecting the environment of the room itself. As more staff members began to feel unwell, the emergency department was forced to shift its priorities. Instead of focusing solely on the critically ill patient, medical personnel were now dealing with a secondary crisis involving their own colleagues. Some individuals collapsed entirely and had to be removed from the room on stretchers, while others were assisted out as they struggled to remain conscious. The chaos that followed was unlike anything typically seen in a controlled medical environment, as trained professionals found themselves suddenly incapacitated without a clear understanding of why it was happening. Throughout all of this, Gloria remained on the treatment table, her condition continuing to deteriorate despite ongoing efforts to stabilize her. The medical team that remained attempted to proceed with resuscitative measures, but the circumstances had become increasingly difficult. Equipment had to be managed carefully, exposure risks were being considered in real time, and the number of available staff had been significantly reduced due to the unfolding situation. Eventually, despite these efforts, Gloria went into cardiac arrest and could not be revived. She was pronounced dead later that evening. What followed her death only deepened the mystery. The hospital initiated emergency protocols to contain what was now suspected to be a hazardous exposure event. Portions of the facility were evacuated, and specialised teams trained in handling chemicals were brought in to assess the situation. The body of Gloria Ramirez was isolated, and staff that had been exposed were decontaminated as a precautionary measure. At least 23 individuals reported symptoms, and several required hospitalisation, with one case severe enough to necessitate intensive care. In the days and weeks that followed, investigators began the difficult task of determining what had actually occurred. Early suggestions that the incident might have been the result of mass hysteria were quickly challenged by the physical evidence. The symptoms experienced by staff members were not only consistent, but in some cases measurable through medical testing, indicating that there had been a genuine psychological response to some form of exposure. Attention soon turned to the chemical composition of Gloria Ramirez's blood and tissues. Toxicology reports revealed the presence of dimethyl sulfoxide, or DMSO, a compound that, while not commonly associated with mainstream medical treatment, had been used in alternative medicine circles for its purported pain-relieving properties. It is known to be absorbed through the skin and can carry other substances with it into the bloodstream, making it both useful and potentially dangerous depending on how it is used. The leading theory proposed by investigators attempted to connect this compound to the chain of events observed in the emergency room. According to this explanation, Gloria may have been using DMSO as a home remedy, applying it topically to manage pain associated with her illness. Under normal circumstances, DMSO is relatively stable, but it can undergo chemical changes under certain conditions. The theory suggested that when oxygen was administered and specific medications were introduced during treatment, the DMSO in her system may have been converted into dimethyl sulfone, which could account for the crystalline structures observed in her blood. The theory went further, proposing that additional chemical reactions may have taken place, potentially converting these compounds into dimethyl sulfate, a highly toxic substance known to cause respiratory distress and neurological symptoms upon exposure. This would provide a possible explanation for the symptoms experienced by hospital staff, as even small amounts of this compound in vapor form could produce significant effects. While this explanation has been widely cited as the most plausible, it has not been universally accepted. Critics have pointed out that the conditions required for such a transformation are typically found in controlled laboratory environments rather than in a hospital setting. Additionally, no direct evidence of dimethyl sulfate was conclusively identified during the investigation, leaving a critical gap in the chain of proof. Alternative explanations have therefore continued to circulate. Some have suggested that the staff may have been exposed to a combination of chemicals present in the hospital environment, possibly interacting in unforeseen ways. Others have revisited the idea of a psychological component, although this does not fully account for the more severe cases observed. There have even been suggestions that an unknown or undocumented substance may have been involved, something that was either not detected or not disclosed during the investigation. What remains undeniable is that the events of that night had a profound impact on those involved. Medical professionals who had spent their careers working in high-pressure environments were confronted with a situation that defied their training and expectations. The idea that a patient's body could become the source of a potentially toxic exposure challenged fundamental assumptions about safety in medical settings. Decades later, the case continues to be studied and debated, not only as a medical anomaly, but also as a reminder of the limits of our understanding. Despite advances in toxicology and emergency medicine, there has been no definitive replication of the conditions described in this case, nor has there been a consensus that fully satisfies all of the questions raised. In the end, the story of Gloria Ramirez is not just about a single patient or a single night in a hospital. It is about the intersection of medicine, chemistry, and uncertainty, and the way in which even well-established systems can be disrupted by events that do not fit neatly into existing frameworks. For those who were present, it was an experience that blurred the line between the known and the unknown, leaving behind a case that continues to resist simple explanation. And perhaps that is what makes it so enduring. Not just the strangeness of what occurred, but the fact that even now, with all the tools and knowledge available to modern science, there are still elements of that night that remain unresolved, inviting speculation, investigation, and in some cases, a lingering sense of unease about what might truly have happened inside that emergency room. If you found this story as chilling as it is fascinating, make sure to like the video and subscribe to the channel for more deep dives into unexplained cases just like this. Until next time.